Recently, I've been noticing an uptick in people saying that discussions of mental health maybe have gone too far, such as this article from July 26, written by a psychologist titled "Stop Pathologizing Ordinary Life," or just a couple weeks earlier, this article from July 5th, also written by a psychologist titled "I'm a Therapist, Not Everyone Should Be in Therapy," as well as comedy skits making fun of self-diagnosis, TikTokers criticizing therapists as a whole. It seems like there's a discussion here to be had. Have people in their pursuit for reducing mental health stigma and increasing awareness gone a little bit too far? I'm going to tell you my opinion, which, spoiler alert, I agree in some ways and disagree in others, but I'd love to hear your opinions down below on everything I'm about to talk about. Okay, so I'm going to show you a few different pieces of media on this topic, and then I'm going to share with you my own opinions.
A lot of mental illness now in America. There's tons. If you don't have a mental illness, get one. Now you go to lunch with somebody and you're like, want to split wings? They're like, I have borderline personality disorder.
The average man, I believe, the average real man, does not need to go get therapy for the battles and the burdens he's carrying inside. What he needs is for those that he's carrying them for to recognize that they're there and to respect it and to be grateful for it. They don't need to talk it out to get rid of it. They need the one that they're going through this hell for to recognize it's there and to be grateful that the man is carrying this for them. They don't need therapy, they need gratitude.
So let me share with you the first New York Times article that caught my attention, which is titled "Stop Pathologizing Ordinary Life" by Dr. Clay Routledge. The article starts by saying that Americans talk about mental health more than ever, yet mental health seems to be getting worse. And the author asks, could our preoccupation with mental health be part of the problem? While I do think this might be a piece of the puzzle, I feel like this question kind of ignores a lot of the other factors that play a larger role. The fact that we are assessing for mental health issues a lot more now than we were in the past, poverty, political instability, the lingering effects of the COVID-19 pandemic on relationships, the drawbacks of social media, so on and so forth. I'm not opposed to the idea that hyperfixating on mental health can make mental health worse. I just don't think it's the main thing contributing, but let's continue. Dr. Routledge goes on to acknowledge that there are benefits to talking more about mental health, such as reduced stigma, but also certain drawbacks. He says if we focus too much on pathologizing certain experiences, we may turn ordinary parts of life into symptoms. By broadening what counts as a disorder, we begin to see it everywhere, including in ourselves. I do agree with this. I think especially on social media, it's too often that I see people trying to turn normal everyday things like rewatching TV shows, rubbing your feet together before bed, feeling uncomfortable during social interactions into some sign of a mental disorder. The author then references a study which found that when people view social media posts that normalize anxiety disorders, they're more likely to self-diagnose with anxiety. He writes that nearly a third of Americans and half of Gen Z adults have self-diagnosed with something based on social media posts. I also agree that self-diagnosis is an increasing problem, and I'll talk a little bit more about that later. But then he offers some alternate ways that people can take care of their mental health, aside from fixating on their mental health, like exercise, volunteering, and doing acts of kindness, finding a sense of meaning in life, especially something that gives you social significance. And he ends by writing that we should be pleased with the progress that we've made on mental health, but also spend less time stuck in our heads and more time out in the world. Before I go into the second New York Times article about this, which is one that I find a little bit more problematic, to be honest, I want to tell you about the sponsor of today's video, Foreo. I've been using Foreo's FAQ 202 mask for a couple of months now, and I've really been enjoying it, just incorporating it into my skincare routine. The FAQ 202 is an FDA-approved LED face mask. LED face masks in general have a body of research to support their benefits, but let me tell you why I like the FAQ 202 specifically. First of all, it's backed by science. This mask uses precisely the wavelengths that have been shown to improve skin, whereas a lot of other LED masks don't really specify the wavelengths that they use. Foreo's clinical trials have also shown an increase in firmness, elasticity, as well as a decrease in sebum and acne. But the second reason I really like the FAQ 202 specifically is it's a lot more comfortable than others. Because it's wireless and lightweight, not super rigid like some other masks out there, it's much more convenient to wear. And I really like that I can just multitask while using it. I can keep keep my eyes open, I can do something else. So here's how I've been using it. Before I start my nighttime skincare routine, after I cleanse my face, I put on the peptide serum that it arrived with, which contains a ton of big hitter ingredients like peptides, hyaluronic acid, centella. Then I put on the mask and start a timer for 10 minutes. And once the timer's done, I just go in with the rest of my skincare routine. And luckily, I've not experienced any pilling interaction between the serum and any of the other ingredients in my routine. I do this only on weekdays for 10 minutes, and it's just become a really cherished part of my routine. You know, while I'm wearing it, I lift the blinds, I sort of get the living room space ready for me to read, and I do really see the benefits. Like, I recently had a mosquito bite on my cheek, and it went away a lot faster than the mosquito bites on my body, which I suspect might be because of the LED mask, since it's known to reduce inflammation and redness. Now, Foreo does have a current sale, which is up to 50% off on their products, but it is about to end soon. And if you use my code DrAnna30, which is DRANA30, you can get an extra 30% off. Thank you so much to Foreo for sponsoring this portion of the video. Okay, so the second New York Times article is titled, "I'm a Therapist, Not Everyone Should Be in Therapy" by Dr. Harvey Lieberman. This one, to be honest, I think took the point a little bit too far, making it not about the way we think about mental health, but rather about therapy. Dr. Lieberman begins by telling us that he's a psychologist with over 50 years of experience, so he's well aware that therapy can be essential. However, he says he increasingly hears people are turning to treatment because of difficult circumstance, loneliness, conflicts at work, financial strain, and that he doesn't seem sure that's necessary or good. He says unhappiness is often not a disorder, but a structural condition, which he seems to attribute mainly to the erosion of social relationships. I mainly agree with him here. Unhappiness is an inevitable aspect of the human condition sometimes, and not something we need to aggressively stamp out. One of the hardest things about being a therapist for me was getting clients who wanted me to sort of wave a magic wand and take away their suffering, but it wasn't always suffering that had a solution. But I would argue even in the situations that he mentioned, loneliness, conflicts at work, financial strain, therapy can still help, especially if you go into it not with the mindset of like, I want to solve my unhappiness, but rather a different treatment goal, like find ways to give this thing less power over me, find ways to connect with people despite this thing, share my suffering with a therapist instead of shouldering it on my own. Among the drawbacks of too many people going to therapy, Dr. Lieberman cites long waits for treatment and clinician burnout. I find the wait times for treatment depend quite a bit on how saturated the specific market is. Like when I was in Washington, for example, the therapist to client ratio was very high, and a lot of therapists were struggling to fill up their caseloads. Whereas in other places, like rural places, for example, it's a bit harder to find a therapist. I also find that it depends what kind of specific treatment you want. A lot of very niche treatments or highly experienced therapists might have a wait list, but you can easily find a different type of therapist. Also, in my experience, the hardest treatment to get help for is typically the very high risk type, inpatient, residential, someone who provides crisis interventions after hours. Really, the people who most need help have the most trouble getting it because it's a very challenging type of work that not a lot of therapists want to do. And on that note, I would argue that clinician burnout is a lot more about systemic issues like insurance is not wanting to pay therapists, limited after-hours support given by the government, organizations demanding the therapists have caseloads in the hundreds. Yes, really, some people genuinely have caseloads in the hundreds. I once had a supervisor who showed us his caseload and it was in the triple digits. But if we're just talking about someone who owns their own private practice and they control their own caseload, clinician burnout is not largely driven by a high demand for therapy. They're in control of how many clients they see. Dr. Lieberman says, when it is effective, it often helps with persistent problems that come from within. Obsessive thoughts that return no matter how often you try to dismiss them, fears that repeatedly damage relationships, periods of despair that continue even when life circumstances improve. Therapy can be especially useful when people's habits deepen their suffering or when painful experiences remain difficult to make sense of alone. But when distress is shaped primarily by situational difficulties or the absence of community, therapy may not be the best fit. His examples of situations where therapy may not be the best fit include people going through childcare difficulties, anxiety after relocating, and a family dispute. He says these issues do not necessarily require clinical intervention. I'm honestly a little bit confused as to how he thinks therapy wouldn't be helpful in these situations. Relocations are extremely high stress. People with childcare difficulties need a lot of support. Family disputes can have massive emotional and social repercussions. To be honest, it doesn't feel entirely responsible to me how he's suggesting that someone going through these situations wouldn't benefit from professional support. Even in situations that I personally would classify as more minor, like a grandparent grandparent passing away or the stress of exam season, therapy can still help. I'm in therapy even though I no longer really meet criteria for a mental disorder. I no longer really struggle with the things that initially brought me in, simply because it helps me cope better with life. And the longer I stay in therapy, and it's not just like putting out fires, the more I can get at the actual root of a lot of my issues. Like the most helpful sessions I've ever had are often the ones where I don't have something massively distressing to talk about, but rather we're just kind of spontaneously discussing different things and getting under the root of something that's been bothering me for a while. But Dr. Lieberman says, all around us, more of what was once understood as part of life has come to be seen as something requiring treatment. For example, he criticizes the fact that prolonged grief is now a diagnostic category. And again, I have to disagree with this. Prolonged grief doesn't necessarily refer to someone missing their loved one years after death. I knew someone in my personal life who was extremely depressed even over a year after the death of a grandparent, who was drinking a bottle of wine every other night to cope with it, sobbing about missing them almost every night, having thoughts of hurting themselves. For situations like those, a diagnosis like prolonged grief is important. I don't think we need to discredit expanding understandings of psychopathology in order to criticize misusing those labels in situations where they don't apply. He says, feeling anxious does not mean you have an anxiety disorder. It could point to circumstances that are worth changing. Yes, and a therapist can help you take initiative on those things that need changing. He encourages people to try other things before seeking therapy, like reaching out to a loved one and doing a hobby. But I'd argue that actually most people don't go to therapy until it's quite unbearable not to. Even myself, I always postponed seeing a therapist when I was struggling until I had no other options. And I was literally a therapist myself. I had no, stigma of mental illness. I didn't think it was shameworthy to ask for help. I just felt like I didn't have the time, and I didn't want to go through the effort of finding someone who was the right match. I didn't want to pay for it. And most other people I know, even when they really need either individual or couples or family therapy, even when they've started to consider therapy because they know they're reaching rock bottom, they don't actually start to look for a therapist until things have gotten really, really bad. Because like I said, therapy can be quite expensive. It takes time. It's usually during work hours, which is tricky with a lot of people's schedules. It requires vulnerability. It requires finding someone who's a good match. So most people would rather just not go through the effort of all that. So that's why I don't really think it's responsible to tell people, a lot of people who go to therapy don't really need it. Because in my opinion, most people who do need therapy don't go to therapy. That's why you will so often hear when someone first goes to therapy, why is nobody else in my life going to therapy? It feels like I'm going to therapy and I'm trying to resolve issues that a lot of other people are involved in. And then Dr. Lieberman cites another psychologist 60 years ago who described therapy as the purchase of friendship. Again, I completely disagree. My therapist is not my friend. I do not call up any of my friends once a week to only rant about myself for 45 minutes, not once asking them about themselves. My friends do not perform evidence-based interventions on me to help me solve my problems. They are not well versed in psychology and every defense mechanism that I'm demonstrating and how to help me become more enlightened of it. I'm well aware that my therapist, although I do truly believe she cares about me, is providing a service and she's not my friend. I feel like this quote kind of gives people the wrong impression about what both therapy and friendship should be. Okay, so those are the articles that I read on this topic. You saw some other forms of media on this, but let's talk more broadly about this conversation. Let me tell you where I agree with some of the points that were brought up and where I disagree with them. Where I agree, I do not think that self-diagnosis is a good idea. Every time I say this, people get mad at me, but unfortunately, it is a hill that I'm willing to die on. Learning about mental health and mental illness can be super helpful for wondering, does this diagnostic category possibly fit me? And going to get a professional assessment to figure that out, and then hopefully getting the type of treatment that is most effective for your specific problem. But even trained therapists cannot accurately diagnose themselves or even someone else in their personal lives, let alone someone who doesn't have the understanding of the hundreds of other possible diagnoses that might better explain what's going on. Self-diagnosis can provide some emotional benefits like feeling less alone, symptoms starting to make more sense, but it also has significant risks like turning something into a part of your identity that worsens symptoms or isn't accurate to your situation, or no longer wanting to get better because you now see it as a part of who you are. like, I've never been professionally diagnosed with OCD, but I have at different points in my life suspected maybe I have it. Maybe I have a little bit of it. And despite that, I have not once in my life referred to myself as having OCD. I might say I have some obsessive compulsive tendencies, for sure. I relate to a lot of the experiences of people with OCD, but I'm not so sure I meet the threshold of what's considered clinically elevated. I've never been diagnosed with it, and quite honestly, it makes no difference to me whether I am or not. I'm already in therapy. I'm already working on the things that bother me. Another point where I agree with this discourse is that mental illness is of course a spectrum, but broadening diagnostic criteria too much can be risky for treatment. And when something falls on a spectrum, the people who have very mild symptoms might find it easier to acknowledge the benefits of that thing that they're describing. But there exists a point at which we have to put the clinical threshold. If we put it too low, at a place where people are not actually experiencing clinically elevated distress and/or impairment in their functioning as a result of their symptoms, then we are doing a disservice to the people who are on the more severe end of the spectrum, who cannot function, who are in extreme distress because of the disorder. We're no longer talking about the same experience. If we're talking about someone on this extreme versus this extreme, they're kind of two different things. The person on this side is not even really talking about a mental disorder anymore. Another point that I agree with on this discourse is that not all experiences of mental pain are pathological, nor do they always have a cure. Just like not all physical disorders have a cure, like some forms of treatment-resistant cancer, multiple sclerosis, dementia, not all mental suffering is curable either. Sometimes all you can do is just find ways to live with the disorder, to focus on meaning-making, to reduce the negative effects on your life. Other times, the mental suffering doesn't even meet the threshold of something pathological. It's just a normal part of life that we'll all have to deal with at some point. The sadness of not getting something you want, the grief of missing someone who's no longer there, the anxiety you feel in times of danger. I remember in the very first session that I had with my current therapist, I was like, I just want something quick. I just want like 10, 15 sessions, and I want to really stamp out my anxiety. And she very quickly let me know that that was not how it was going to go. And it kind of rewired my brain because it got me to think less in terms of like, I'm trying to avoid this emotion, and more in terms of like, let's just explore what's going on here. The more you resist pain and the more you avoid painful emotions, the worse it gets. That's why sometimes when you're in physical pain, breathing into the pain can be more helpful, whereas resisting it and saying like, I don't want to be in pain, I hate this, can make it worse. And this is directly linked to another point that I agree with on this discussion, which is that where attention goes, energy flows. Meaning you need to focus on what you want more of, not what you're trying to get rid of. And I think sometimes when we hyperfixate on the things about our mental health that aren't going well, we're doing ourselves a disservice. Therapy goals and life goals in general should not be overwhelmingly about what you want less of. They should also include what you want more of. Because, for example, the more you think about how distressing it is to have a mental disorder, the more resistance you're putting up to the experience, and the more your suffering compounds on itself. Versus if you just turn your attention to something else that's important to you, something that you want more of in your life, that will actually be much more beneficial. The thing that was distressing you is going to feel a lot less distressing. That's actually the entire concept behind my journaling workbook, A Season of Life. It's specifically designed to help you focus on the things that are improving your life. For me personally, it just really helps me stay grounded. And the last point of this discourse that I agree with before we go into the things I disagree about is that if you want to get better, you do have to do things outside of therapy that will help you get better. Therapy can also help promote those behaviors. Therapy is just 45 minutes of your week. You have to actually implement what you learned in therapy outside of therapy. Like, I always journal after therapy. Some people ask their therapist for homework. Some people do worksheets in between sessions. Some people set goals for themselves. The exact method doesn't really matter. What matters is that you take what you've learned in therapy and actually apply it. Otherwise, it's kind of like reading a self-help book, forgetting everything you learned the second you close the book cover, and then blaming the author when your life doesn't improve. Okay, so that's everything that I agree with about this discourse, but here's where I disagree with some of the points. Most people don't seek therapy until it's literally their last option. Dissuading people as a whole from going to treatment if they don't really need it is not responsible given that reality, because you could very well be scaring people off of therapy who genuinely need it. But, to give Dr. Lieberman, the author of the second article, the benefit of the doubt, it could just be that maybe he's exposed to a different population than I've been. That in his experience or his colleagues' experience, there are people coming into therapy that don't really need it. That just hasn't really been my experience, which is why I'm kind of opposed to it. Also, therapy can be beneficial even if you don't necessarily meet criteria for a diagnosis. It can help you achieve a goal, build relationship skills, practice a healthier way to relate to another human being via the therapeutic relationship, improve your self-esteem, lower your defense mechanisms, get better at communication, think about things in a healthier way. There are so many things that it can help with, even if you don't have a mental disorder. That's part of why I think self-diagnosing isn't really necessary, because you don't need to prove that you deserve support by giving yourself a label. You deserve support whether or not you meet criteria. Also, I feel like the drawbacks of us discussing mental health more as a society don't necessarily mean we should cut back from talking about mental health. I think it just means that we need to also caution people against taking these discussions too far. I think it's telling that a lot of the people having these conversations are psychology professionals themselves. Me, the two psychologists that wrote those articles, the professionals are warning people. They're giving people more information, but they're also warning people about taking that information too far. It's the lay people making psychology content that we need to be a little bit more mindful of, because they might not be as aware of where they're taking it too far, and they might not be communicating that to their followers. But I don't think it's a coincidence that a lot of the people having these conversations are men, and that there's an entire branch of this discourse saying men specifically shouldn't be in therapy. Remember that brain dead TikTok I showed you at the beginning of this video?
The average real man does not need to go get therapy.
I think that type of men, just repress your feelings and don't ask for help attitude is probably related to this discussion. I think it's why a lot of men in particular, some of them therapists, are lamenting the fact that people with subclinical issues are now asking for help and talking about mental health with professionals. As long as we tell people that they need to bottle up their feelings and handle everything on their own, these attitudes are going to keep trickling in. And sometimes they're going to keep trickling in even among psychology professionals. And then those people are going to sort of sow seeds of doubt in other people about whether their issues are severe enough for them to ask for help. And while we're on the topic of funny coincidences, I also think it's telling that this anti-therapy wave is overlapping with the broader wave of anti-intellectualism and mistrust in mainstream science, like in the MAHA movement. There is something to be said about overcorrections. I'm not opposed to the idea that maybe therapy or conversations about mental health have gone too far in some ways. I'm also not opposed to the idea that healing comes in many forms, and some people may prefer to heal through spiritual guidance, through social connection, through physical movement, through alternative medicine. But be cautious of people whose solution is to overcorrect yet again in the opposite direction. Whose solution is, no, let's stop talking about mental health. Actually, you don't need therapy. Your issues aren't serious enough. Just drink some raw milk, say no to the vaccines, and you'll be fine. Those approaches obviously have some serious drawbacks as well, but what they won't have is the safeguards of mainstream healthcare in place. So be careful of overcorrection, especially if it's in a direction that could be potentially dangerous. But what do you think about all of this? I'm really just hoping to have kind of a nuanced conversation with you guys. Because like I said, in some ways I agree with the discourse and in some ways I disagree, but we all have different perspectives. Thank you for watching and take care.